Well, here I am, the time traveler again, to remind you of a critical moment in time as regards to your health care and most importantly the health care coverage. Probably everybody knows that Medicare is entering what they call an open enrollment period. Again, I actually I did attend a webinar by AARP, which provided an awful lot of basic, useful information to people. And I'm sure that it's still available. Maybe it's, I don't know, maybe it's on YouTube, I'm not sure. But AARP, American Association of Retired Persons, is a phenomenal resource as regards to how to help ourselves get the best possible outcome. That's really what it's all about. We're going to be here a lot longer than we expected. And how can we do the things that are helpful? But nobody is forced to do anything. But you might think it's beneficial to have a comfortable, interesting, productive aging process, since that is what is available these days. And it's a product of a whole lot of factors, but here we are. So one of the things to be very cognizant of, shall we say, is the status of our healthcare coverage, because that has a lot to do with the beneficial interventions that we receive and that have given us this longevity that we're enjoying. So in any case, Medicare is an open enrollment period. There are a lot of changes going on. The federal budget freeze, all of that business could make the process of doing whatever needs to be done within that time period be a little bit more stressful or require a bit more attention. Whatever. I know for myself, I have already received from both my supplemental insurance carrier a monthly increase for that one, and then the people did finally come up with their number, which was a it almost doubled. And I don't really take anything, but I mean, you know, everybody has to have some prescription. But in other words, it's not a high price product that I'm dealing with. So I was surprised at how they increased the number. Uh, so we're going to see that there are changes. And then we look at how these changes will impact us and then decide what it is that we feel is a sensible way of taking care of it, because it's important. Healthcare is is our secret weapon. That's why we're the this long-lived generation. It's with the help of modern healthcare that we have come to this place. I remember when I was a kid, like men in their 50s were dying of heart attacks in the 1950s. But now, we have the interventions that make it possible for us to carry on. So we want to make sure we have the coverage and then that's a whole other thing. I don't even know what to say, because Medicare and Medicaid are both government funded health insurance programs that have essential functions and often work collaboratively in terms of paying for care based on situations. And so we do have a big interest in having an appropriately functioning, funded healthcare system to support us in our our functional longevity quest, where we enjoy the years that we have now, and see what kind of new creative almost explosion, not, I don't want to, creative energy that could come out of that. And of course, people are doing all kinds of interesting things, and I want to learn more about that as I go forward. But right now, there's like just something to focus on, which is what's your health insurance coverage, and is it adequate for what you need? Uh, so, welcome to the journey. The time traveler and her faithful friend, Marjan, and it's very interesting as I see what people are doing as they move into this phase of life, this exciting new opportunity to learn and grow at a time when you might not have been even around, So in any case, have a great day, enjoy yourself. Thanks for watching. I'm the Time Traveler, carrying on.